Assalamu alaikum. I'm Dr. Ziaullah Shah. I'm a professor as well as HOD in the Department of Allied Health Sciences, CECOS University. I joined CECOS University in May 2019, and since then I'm working as a professor. In 2023, I was given the responsibility of leading the Department of Allied Health Sciences, and since then we are working hard to establish the Department of Allied Health Sciences on modern grounds. How much are we successful in doing so? You are the best judge. The students, are the parents. They can visit our department and can judge for themselves. I can count quite a few reasons that will give you an idea why we stand out. First and foremost, CECOS University has a multi-layered process of hiring faculty. Every faculty member that we have gone through that rigorous process of hiring. So I can claim that we have the best faculty in institutions working in allied health sciences in KP. Another thing is that our faculty are really motivated. They're highly energetic individuals. We are always ready to embrace change in the rapidly evolving healthcare academics. This gives our student currency in the domain, and that currency will enable them to lead in healthcare setups. Another thing is that our faculty, all the faculty members are connected with their students in real time. All this is to ensure student centricity and that maximum learning happens. We have state-of-the-art labs. Regarding labs and classrooms, I can claim that we are at par, if not best, with any institution that claim to be top class. I will happily give you an opportunity, all the students and parents, to come visit our labs and classrooms and decide for yourself. We are ready to embrace changes, and that's why we are regularly reviewing and revising our curricula. The whole objective is to provide state-of-the-art education to students. We have MOUs with modern hospitals like RMI, Peshawar Institute of Cardiology. For DPT students, we have MOUs with the Paraplegic Center Peshawar. We have MOU with Afridi Medical Complex. So all these MOU is to ensure that student gets structured, supervised clinical practice opportunities. Not just that, we are also interested in giving a head start to students by providing them opportunities of internships in leading hospitals. Our CDC is actively engaged in discussions with these institutions. Our faculty members are very motivated in conducting state-of-the-art research, which gives students the much needed currency in the domain. All these factors are present in DHS CECOS University. Again, I would love to have you in CECOS University as visitor before you decide to take admission and pursue your future career in allied health sciences domain. We do realize the importance of labs in healthcare academics. Our labs are state-of-the-art. We have acquired state-of-the-art equipment and consumables and equipped our labs with it. Our academics or faculty members realize the importance of lab. Every lab session is important. We enforce this concept by actively engaging our students in lab classes. We are also open to modification with the evolution of healthcare. So our Board of Studies is continuously reviewing our academics, our curricula, including our lab curricula. We are open to changes. We bring in changes whenever we feel the need to change. The degree programs in allied health sciences that we offer are very practical with defined career paths. Our students are working in both public and private sector hospitals. We're glad to know that some of our alumni are working independently. They are now in a position to give jobs to fresh graduates, giving them head start. We also know that some of our alumni have chosen to pursue higher education and have secured admission in graduate degree programs in the UK. We have multifaceted MOUs with our partner hospitals, which essentially means that our MOUs are not limited to student trainings. The major bottlenecks in healthcare research is access to hospitals for data collection. Once you have shared goals with your partner institutes or hospitals, it becomes a lot easier to access healthcare-related data. We have a very rigorous procedure of review of students' projects proposals. Once the project proposals are reviewed for their potential impact, they are given a go-ahead. I'm very glad that research culture in the department is thriving. If you want to pursue a career in healthcare in the future, choose an institution. Student centricity for whom is a core value. Choose an institution where the core elements for delivering quality education, like MOUs with modern hospitals, quality healthcare, quality curriculum in the healthcare, and motivated and qualified faculty are all complete. Choose an institution where the labs are well equipped and practical trainings is given importance. So choose wisely, choose CECOS University.